drive doctor.
Morning, man.
Yes. I think we're going to get into it now.
Right.
All right. So we've learned about all the individual cancers over a period of almost 4 weeks.
Right.
Now, as we start to wrap up our series on cancer awareness, I've started to ask myself, why is it that in Ghana we don't do so well in the fight against cancer? Why is it that so many people don't survive? Whereas in other parts of the world, survival rates seem to be so encouraging. We keep hearing stories of people beating cancer. How are they beating it and we are not?
Right. Good morning once again to all our listeners. And Kojo, you asked a very important question. Although it appears very simple, it is not. The answer is very complex. And we will try in the next 10 or so minutes to unpack the answer and make it a bit simple. There are three main things I want us to look at. First is what we call early detection of the disease. So cancer is a disease where you have a proliferation of abnormal cells. And Kojo, we're talking about cells. I always say a bit of biology would help. Biology 101.
Yeah.
So the basic functional unit of a human being is a cell. A group of cells come together to form a tissue. Tissues come together to form an organ. Organs come together to form organ systems. And then when you put all the organ systems together, you have an organism, right? Or the human being.
Yeah.
So the cell is not visible to the unaided eye. All right? You need a microscope to be able to determine or detect it. The cell can elaborate certain chemicals depending on the type of cell. Those chemicals, again, you would need certain tests to be able to identify them. So the first thing we need, or area we need to talk about, or that goes to answer the question you posed, is in the area of early detection. If you find it early, you get the survival rates that we hear about in other centers. It doesn't become a fearful condition anymore, all right? Because you can deal with it. And we're not just saying, oh, early, if you find it early. It's people trivialize that statement, but there's a whole lot we can do if we find it early. And later on, I will, go into that. So under early detection, we've got two things that we do. We have screening, all right, for cancer, screening programs. And then the second thing is early diagnosis. So under the early detection, there is screening and then you have diagnosis. Now, screening means that you're looking at a population or a subpopulation who have risk factors for developing the disease. Screening doesn't involve everybody. So let me use an example, prostate cancer. There's no business screening somebody who is 30 years, 25-year-old male, 32-year-old male, except they have a strong family history of prostate cancer, first-degree relatives, then maybe. But generally speaking, we would reserve that for men of a certain age group, all right, to screen them because they are the at-risk population, okay? So screening programs are important, and Kojo, because of your time in the UK, you would know about this when it comes to the pap smear, for example, which is a test that is used for cervical cancer screening. You get a letter in the mail if you're a female and you hit a certain age. You wake up in the morning and the mailman has delivered it. Your GP informing you that, well, just in case you forgot, you turn 21 or on this day, so you are due for XYZ. They tell you where to actually report, for that investigation to be carried out.
Yeah.
Right. So that's part of their system. All right. That's not an individual making that decision. As a nation, they have decided on a screening program. All right. So that decision we need to also start to look at that and see how we can introduce that into our Ghanaian, healthcare system.
In truth, we are almost there. I mean, in terms of what we need for such a thing to be possible.
Absolutely.
We already have digital information on our citizens.
Exactly.
We can already identify and in many cases locate
Exactly.
our citizens.
Exactly.
So the fundamentals for such a program exist.
Infrastructure
and
is there.
if we can start, then it can only get better with time.
Exactly.
Right?
You know,
we know when people were born.
Mm-hmm.
We know when they will turn a certain age.
Mm-hmm.
We know those who have already turned that age.
Exactly.
It's all there. The information is there.
Yes.
So the healthcare system, national health insurance, it is in their interest really at this point to be initiating something along those lines.
Exactly.
So that those we can reach, those whose phone numbers are on record, those whose addresses are on record, we can reach out to them and say, you are a female of this age, it's time for you to go for your screening.
Exactly. So we begin to look at
this location.
Go to this location, and you'd have it.
Yeah.
So, Kojo, that takes us to the second bit of the early detection, which is the diagnostic capacity. Because they go to this place to have the pap smear done, go to this place to have the mammogram done. The question then is,
Which place?
which place? And does the place have the capacity?
Yeah.
So when we talk about early diagnosis, we're looking at human resource. So we deliberately did something this month. We showcase to Ghanaians that we have the men. I hope I can say that.
We have the men and women. Yes,
we're here. Pluralistic. That's why we are not doing politics here. But we have the men. But that's what we did. Dr. Samira was speaking yesterday.
Yes.
We've had
Professor
Kafui Akakpo,
yes.
Dr. Fair, so many different. We wanted to show Ghanaians that we've got a human resource, or we've got at least something that we can start and build on. I mean, look, 30 years ago, or even when I started med school in the year 2000, we didn't have that many. Always been there, but we didn't have that many. But yes, we're not doing badly in that front. If you put the human resource aside, and please, the human resource is not only doctors. You need to have oncology nurses. You need to have clinical psychologists who have expertise in palliative care and so on and so forth. Palliative care professionals, and so on and so forth. So it goes just beyond the doctors. Then again, in that same institution where you are asking people to go to be screened, the question is, do they have the diagnostic tools? From X-rays. A mammogram is a special type of X-ray machine. So if we say Pink October and everybody should go get a mammogram, if that person is in my home district of Esujamai, Sami or that means hometown of Edu, and they want to go and get a mammogram, how easy do we make it for them to go get the mammogram? A breast ultrasound scan. So an ultrasound scan is also a device. These days, the ultrasound scan machines, the screen, it can fit into your pocket. And with a transducer, you can walk around with it just as people walk around with a briefcase, and do scans, ultrasound scans.
Yeah.
We can talk about CT scan machines, all right, which gives you 3D images, better resolution. MRI scans, all right, PET scans. How many of these do we have here, and what's the distribution?
All these things currently, you have to go to some place in Accra and Saline to get it done.
Exactly. I mean, we all heard about that fracas that happened at Ridge Hospital. What occasioned the whole thing was because there was a delay. They didn't have a certain machine working, and they wanted to transport the patient to go do it somewhere else. So equipping our facilities, and Kojo, these are the big machines that you can see, but they are the smaller machines that you cannot see. As a chemical pathologist, I do molecular methods, all right, tests. So I take a blood sample and then we'll run a test on it. Some of these devices have been so miniaturized. They're so small, but they're so powerful. They're very expensive, all right. Professor Akakpo, as an anatomic pathologist, he will do things, molecular methods, something we call immunohistochemistry, all right, flow cytometry, to look at very, very microscopic details about cells to be able to clinch the diagnosis. Sending specimen samples to South Africa, to India, before we get certain details to firm up the diagnosis means that we have a longer turnaround time.
2 weeks, 3 weeks sometimes.
More than that. To get the results back. So the turnaround time tends to prolong the diagnosis, and therefore then we move away from the early diagnosis bit. So early detection means that screening programs and diagnostic capability. Now, the second reason why we sometimes don't get the results as in other jurisdictions is also when it comes to the therapy options, cancer treatment options. All right, there are a whole lot: surgery, chemotherapy, radiotherapy. These are the three big blocks, or the three main legs. But when you delve into the surgery, then every cancer is unique. All right, you have a cancer that's in one lung, and sometimes you can take out that lung, and you can function on the one that is left. All right, you need a certain type of expertise, cardiothoracic surgeons. All right, and a cardiothoracic center. All right, I'm sure we're all very familiar, with a cardiothoracic center because of a certain professor from Pomboatin.
That's right.
With that, can we have more of such centers? So that we don't have the national cardiothoracic center. Beyond that, can we have it in other parts, of the country? Because when we had the conversation about lung cancer, for example, we spoke about how household pollution, using organic material for firewood, for cooking, meaning firewood, charcoal, and the amount of smoke it generates. And who are the ones cooking? Our women.
Yeah.
Our wives, our mothers, our daughters. Just to make some Banchian PCA for us, they end up with lung cancer. So if it happens, what treatment options are available? We don't have enough dedicated centers in our part of the world. So if you take the National Radiotherapy and Oncology Center in Kolebu, you take out Konfanoche, Ridge Hospital has something for pediatric oncology children, starting then NASA. We don't have a lot of dedicated centers. Private sector is also trying to jump in. So I think most people would have heard of the Swedish Ghana Medical Center.
Yeah.
And I think Dr. Pachi was an oncologist who spoke with us during the first week. That's where he works. We don't have enough. So the treatment options are also the reasons why we don't get the results that we get. When we talk about bone marrow transplant, and yesterday I think Dr. Samira spoke to us about bone marrow transplant for some of the leukemias, acute lymphoblastic leukemia, which you'd find in children, and some of them would need a bone marrow transplant, even leukemia in adults. All right, we don't have organ banking or tissue banking in our part of the world. And I remember many years ago, I'm sure Kojo, you'd remember Danny White. He came from the UK.
Yes,
he was mixed parentage. Mixed race.
Caught up in that.
Exactly, we got caught up in. He generated a lot of awareness around leukemia.
Yes.
Because he needed a bone marrow transplant.
Yeah.
But in the UK, because of his race or racial background, the bank that they have is not likely he would make a match. So he came to a place where Ghana, where most likely will have a match. If we built on that, we probably would have been at the point where we have organ banks or tissue banks. Because the bone marrow is a tissue. All right, so we can have tissue banks where people can donate, and then if somebody needs to have a bone marrow transplant to cure them completely of a bone cancer, then we can reach into that bank. It's just like, think about it like, I heard you wanted to be the ambassador for
Bank of Ghana. I'm very serious about that.
That's money, you know. But you put the money there, then you can take it and get it anytime you want.
Yeah.
So it's a bone marrow. When we talk about tissue banking, it's the same thing. You know, so many people put the money there, and if somebody needs it under certain conditions, then you can get it.
You see, I keep saying that there is no tragedy that is big enough for Ghana to learn lessons from. Doesn't matter how many people die or how sad the death is or how tragic the event is. We don't learn. It's not enough for us to learn.
Yeah. Sadly.
We never do anything to prevent it from happening again. We say never again, never again, never again until it happens again.
Yeah.
What a pity.
Lip service. You know, so the treatment option, even with the medicines, all right, the chemotherapy, all right, chemotherapy is quite painful. We're using very powerful drugs to attack the cancer cells, all right, and to restrain them, okay. But Kojo, there are so many good options. Cost, it then becomes a very, very important aspect of it. So these newer chemotherapy drugs are very expensive. And we had the day in the studio last week when we did the Cancer Survivor series. And yes, I think she mentioned that you know, breast cancer treatment, because hers was hormone sensitive, you would have to get hormone sensitive drugs, and it is very expensive. You know, the day of fair, you know, when we did, I mean, there was Florence the day as well. There was a surgeon who did the first week for us. But how many people can afford these things? So, Kojo, that goes to answer the second part of the question as to why we're not getting the results. It's the treatment options that we don't have enough of, or sometimes they are out of the reach. And when it comes to pediatric cancers, then it's even much more painful, because then the child doesn't have money of his own, you know, and they have to depend on the parents. And if the parents can't, you know, don't have it, then it becomes a problem. And we need to then look at what is the nation doing about it. And I remember the campaign about Priscilla, that young girl. That one was with chronic kidney disease. She needed dialysis. She couldn't get it sometime last year. So children are then very, very vulnerable. The last aspect as to why this doesn't happen is also then our health-seeking habits as individuals. Our health-seeking habits. And I've been doing this job for almost 20 years now. All right. And Kojo, if you ask me, and if you ask a lot of my colleagues, we see late presentation of nearly everything. It's just forget cancer for a bit. Let's talk about health, our health-seeking habits. What would take people to a hospital? You know, is it when they see maggots coming out of a wound on their foot? Is that why is that when they're coming to the hospital? Why is the seeking health care the last option in terms of the options that people have? You know, is it because of the way we are socialized? Is there something cultural? It's one of those things where I think we really need to stand in front of the mirror, look at ourselves, and say we can do better.
You gave me an example. I wish you would share this with our audience. I don't know if you're able to share the pictures.
Oh, we are, so long as it doesn't identify anybody. But
you can't see the person.
I think I showed you something because I just wanted to make a point. This is a picture I had, 6-7 years ago. You know, I still kept it. For a woman with who came to me with breast cancer. But she came complaining or pointing to something behind the right ear, saying that she has got a boil behind the right ear. It looked very, very ripe. Like you could easily pop it just with a needle. But when I touched it, it felt very hard. It felt like the table we were sitting around. Very
hard, like wood.
Hard like wood. You know, and I was like, hold on. Is this painful? She said no. Then I sought her permission to examine her breast. And Kojo, you saw the picture.
Her right breast was rotten.
It was gone.
It was like all you could see was the remnants of what used to be a breast, just rotten away. Some sort of wound.
Yes, a scar.
Disgusting.
You know, yes. It wasn't. You wouldn't know it's a breast if somebody hasn't seen a breast before and you show that to them. But we had the benefit of the other breast. All right, for us to be able to make the comparison. Although the other breast wasn't healthy as well,
but at least it still looked like it.
Yes, this one was almost gone, and you just see the remnants of the destruction that cancer can do to the breast. And that is when she's coming to the hospital for the first time. I tell you, that thing which she reported as a ball behind the right earlobe was actually what we call metastasis. One of the key characteristic features of cancer cells is that they don't sit still. Cancer cells move. They're always on a march. All right? And they've got what it takes to move. They jump into the blood goes everywhere. We've got something else we call the lymph. It's also a certain network. They jump into it and then they go everywhere. So she's come to us with very advanced cancer.
Breast cancer.
And Kojo, the question there is, women take a lot of pride in the nature of their breasts. What will make somebody sit and go through watching her body decompose and not seek health care? And that's the question about where the individual responsibility or liability comes in. Are we ignorant about health issues? Is that it? And that's why when Sammy proposed this, then I jumped at it. I was like, oh yeah, anything for us to talk about health, I'm game. Let's do this. Let's educate people. Let's empower people. We call it health promotion. We got to empower people for them to take much more active control over health decisions.
And thank God you did, you see, Doc, because when you gave me this example of this lady, right, and you've just explained what metastasis is, so that she had breast cancer.
Yes.
Her breast was rotting away. She was seeing it every day. Never thought to take it to hospital. But eventually, when the cancer cells moved into her bone,
right,
and made the bone behind her ear swell into that big ball, which is why it felt so hard, right?
Absolutely.
When that happened, then she came to hospital, and it made me think, okay, so her breast was covered with her clothes.
Yes.
No one could see that one of her breasts is rotten. No one could see it. No. So she never felt the urgency to bring to hospital.
Right.
But when she had a massive, what looked like a boil behind her ear, that one, everyone could see it.
Exactly.
She couldn't cover that. So just
some people will get into motion.
That mattered to her more than her health.
Sadly.
So it means there is a certain cultural thing at play, which is getting in the way of our health-seeking habits.
Absolutely.
And we talked about how you and I...
So that's a very good hypothesis for us to test with research.
Precisely. We talked about how you and I, whenever we mention on air that we have diabetes, people who care about us immediately get on our phones. I get 10 text messages. Kojo, why are you telling everybody that you have diabetes? Why are you mentioning it? Exactly. Your enemies will get you. I wonder how. How would that enemy... So Samuel Dame is my enemy. He wants to get me. Now he knows I have diabetes. How will he use it to get me?
Maybe he will go and then he will tell the person that he should meow inside.
Meow the diabetes inside. But I already have it. So you see, there's something cultural there.
Yeah.
Right? And it's something for us to explore because it could unlock the solution to this whole cancer, this whole early detection thing, which then brings about the ripple effect of, proper screening, proper diagnosis, and proper treatment.
Right.
So there's something here.
Yes.
Doc,
low hanging fruits.
Yes. Yeah. Here's Gifty in Kaswa. Hi, Gifty. Good morning.
Good morning.
How are you today?
Fine, thank you. How are you?
I'm all right, thanks. And thanks for calling as well. So, what's on your mind? Yeah.
So, yes, I wanted to ask that if we have normal teeth, there are people that are normal, how do we differentiate from that and the abnormal one?
Okay, all right. Good question. Very good question, Gifty. Thank you for calling in, and Dr. Yaw Osafo is going to address that. You can call us to 0302-216-541, 055-1111-997. Shall we deal with this one while we wait for...
Could you what she asking about normal and abnormal one? I didn't quite hear that.
I think she means cells, right? Isn't that what she meant? How do you know the difference between
abnormal cells.
Normal growths and abnormal growths.
Okay, all right. If I didn't quite hear that, but if that was the question, then I'll simply say this. For you, the individual, it's not possible to tell. So we would say if you have a growth, we would simply call it a tumor. A tumor is a growth. All right. If you have a growth popping up any part of your body, it's a skin. All right. A dark nodule. All right. Small growth, well circumscribed, 1 centimeter, 2 centimeter on your skin. Please have it checked out, because it can be something we call malignant melanoma or a melanoma, which is a very dangerous type of skin cancer. All right. So if you have any abnormal growth anywhere in your body, please go and check it out. Even the doctors, we will not be able to settle on it as a normal or abnormal growth when we look at it. That is where we would sometimes take what we call a biopsy, all right, as part of our investigative techniques. A biopsy means that we take a piece of the tissue or the cells, and then we send it to Professor Akakpo and his team, anatomic pathologists. They would examine it under a microscope and run other tests on it. Then they are able to tell abnormal cells from normal cells.
It's not for us to tell. The experts will help us.
Exactly.
Anything you see, report it.
Yes.
Okay, let's take a few more. Enam is in Oyarefa. Hi, Enam. Good morning.
Hi, Kojo. Good morning.
Yeah, it's great of you to call. Well, what's on your mind?
Yes, I'd like to find out from Dr. So, I was having an abnormal discharge recently. I thought I was eating. It wasn't clearing. It started to drink. And so, but recommended that a couple of scans, including an abdominal scan.
Okay.
And the gentleman who had the scan done told me that there was an 8 centimeter size of an ovarian cyst. And then it looked like there was a mass around it.
Okay.
But when I went to consult, doctor said, oh, it wasn't a problem. And that those things usually resolve on their own. So I wanted to pick his mind on that. Should I be worried?
Okay, you heard that, right?
Right. Yes, I got that.
Right. Let's see if we can get a few more, and then you could answer them together. 055 1111 997, or you could try 0302 216 541. Okay, this was a question about a diagnosed ovarian cyst.
Yes.
But then there were some concerns. What was she worried about?
Right. So she's asking about the mass. So an ovarian cyst, I think we got Professor Pong in the studio to also talk to us about ovarian cancers. So she's got legitimate concerns there. But I'd say this: an ovarian cyst is also a mass. You've got fluid collection in the ovary, all right? So then it becomes bigger. The ovary becomes bigger than what we expect. But it's a fluid collection, and it is a benign swelling, all right? Where's the fluid coming from? Well, 60% of your body weight is water, you know, so we're made of water. Once your doctor took a look at it, probably examined you as well, they would have had all of the information. I don't have the full information, the history, and your physical examination. But if the doctor concluded this is an ovarian cyst, we're not just going to say go away. The doctor will give you a follow-up schedule, and then we'll do what we call the watchful waiting. Sometimes, if it's an ovarian cyst, it resolves on its own. The water drains away by itself. Unfortunately, sometimes it can get infected. You get antibiotics, and then it resolves. So an ovarian cyst, it's a very different type of situation from an ovarian cancer, although both of them will show an enlargement of the ovary.
Okay, all right. So as long as she's been diagnosed by a doctor who says it is a cyst,
yes,
and not a tumor or a cancer, then it's about watchful waiting.
Yes. If she's worried too, she can do a second opinion. We always have that as a second opinion, you know, so that's always easy to do. You can get a second opinion about it, where you repeat the scan, and elsewhere we do a different physical examination. So a second opinion is welcome.
So Marty is listening to us at SSOI. The question is, please, I feel pains in my arms through my wrist. How can I check if I have cancer? That's the first one. The second one says, can you ask the doctor for me if there's any positive correlation between prolonged water fast.
Yes.
The kind of fast that gets the body to enter into a certain phase. There's a technical, is it
Autophagy.
Autophagy phase. Is there any positive correlation between that and cancer? I think that's a question coming through from Martin. Yeah.
Right. So let me take the second one first. No, there's no scientific correlation between. I don't know what he means by prolonged water fasting, but that is not even something that we would encourage. The body needs water. It's the reason why, blessed, we are having. We're looking for water on the moon, water on the different planets, because you need water. And as I mentioned, 60% of your total body weight is water. So your cells need water. Dehydration kills you faster than malnutrition will do. So but there's no correlation. We don't know any particular cancer that is caused because somebody underwent the so-called water.
So what is autophagy? Is that dehydration?
I am not quite sure what he means by autophagy. You are sort of like eating. Phagy means you eating or you are swallowing something, so auto means your own cell, you are consuming something by yourself. Your cells are sort of like consuming themselves. But water deprivation is a very, very dangerous thing. I would never, as a chemical pathologist, never encourage anybody to deprive themselves of water.
But there is no
where that is coming from.
Yes.
Christian fasting and all that.
Yeah, but I don't know about whether they talk specifically. Christian fasting talks about water,
Look, I'll tell you one thing that is very interesting to me. You can read the Bible from the beginning to the end, and you will never see anybody classifying fasts. You never see anyone in the Bible saying that Jesus did an Atkins fast, or he did a dry fast,
that's what
this type of fast or that type of fast. All they say is that he fasted.
Yes.
Right, but we then create different rules around it.
Absolutely.
And it's some of it is for health reasons, some of it is for religious reasons.
Yeah.
But either way, it shouldn't include depriving yourself of water.
No. Well, water is an absolute essential for survival. I think there was another question about pain in the arm.
Whether
all right.
That translates to
whether or not you should be concerned about cancer. I'd say this. Not specifically answering his question, but I'd say this: pain can be one of the presenting symptoms of all cancers, whether it's prostate cancer, whether it is bone cancer, muscle cancer. It can present, the first presentation can be pain, all right, but you can have pain from so many other things that have nothing to do with cancer. All right, so we definitely need much more information to be able to make a determination. So again, this goes to the health-seeking habits. If you've got pain in your arm, you should be concerned. If that pain has been persistent, go have a chat with your family physician or your doctor. Walk into any hospital, complain about it. Let somebody who knows examine you and order the necessary investigations, and we will be able to give you better answers then.
One thing that is clear to me is that parents have a very strong role to play in developing the health-seeking habits in their children.
Absolutely.
I remember growing up, my parents would want me to tell them everything that happened to me.
Yeah.
If a hair came out of my eyebrows, they want me to tell them.
Yes.
Now, some people will think, no. But how else are you going to know when something abnormal happens?
Exactly.
They must be in the habit of reporting every unusual thing.
Yes. All changes.
Yes,
changes. All changes in there. But don't take it for granted. A lot of people have headaches. Yesterday we heard Dr. Samira talk about the cat eye, the white.
Yes.
How many times don't we take photos, all right, with a flash? And you look back at those photos, and instead of seeing red in the black of the pupil, which is a normal thing, you begin to see a whiteness. That is one of the early signs that a child has retinoblastoma, which is a certain cancer that affects the image plates, the retina. It's an early one. Not when the eye is bulging out, pushing out, what we call proptosis. If that is when you're reporting, then it's a problem. So there are little things that we need to train the next generation to be aware of and come into hospital. Look, I work as a doctor, as a healthcare professional. Going to the hospital is not something that entices me one bit. So I know that it's not a fun place. It's not Safari Valley. Right? It's not. But we need to start to look at health in a different context. And sometimes, okay, what are you prepared to sacrifice just so that you know and pick up things early? That's how, I mean, even sometimes I see it. We need to even sometimes take on board the how uncomfortable it is, just so that you can get a diagnosis, so we can intervene early.
So important. I think that should be our take home from today's entire discourse. That look, just get checked as often as you can for everything that is a change in your body. Right? Yeah. You would have noticed the two callers we had were both ladies. The health seeking habits are better among women than men.
I always mention this.
Studies,
I always,
right?
these are informal studies. Every month when I do the analysis of patient attendance, more females come to the hospital than males.
Yes.
But we've got almost the same anatomy with just very small differences. Yes, women don't have a prostate, but men also don't have a uterus. So almost sort of like balances out there. But then almost everything is shared. So why is it that the women have, generally speaking, have better health seeking habits? Again, is it because of the way we are socialized as men? And what I be to be an alcohol hospital? There's something small now alcohol hospital. So this macho-ness or a certain image that we want to create that we are healthy, not encouraging.
Oh.